Hey everyone, welcome. It's Chris for Vienna Care. Today I'm going to show you how I'm going to get rid of my peanut head. If that sounds interesting to you, keep on watching. Now, as we age, we tend to get very hollow in this temporal area. Your only options that you can do is, PRP injections, filler injections. What I love threads, as we know, but you could also use various thread techniques to actually give you a more natural and subtle result that's cumulative, that happens over time. You have a bunch of different options on different types of threads you use. Now you could use PDO, or you could use PLLA, you could use PCL. The options are limitless. Like, you can do what's best for you. You can use smooth threads, you could use screw threads. Now PDO threads are gonna have great results, but they also last the least amount of time. If you're someone that's new to threads, a PDO smooth thread is probably gonna be the best thread for you to start with, so you can actually see the results. I wouldn't jump right into just doing, immediately a PCL, because the results of a PCL thread, the benefits can last up to 2 years, which is great if you place it in an area that you want to have that type of volume and rejuvenation. The downside to PCL threads is that if you aren't happy with your results, you actually need to wait up to 2 years for that thread to actually dissolve and go away. The only other alternative would be to remove the thread, and that can sometimes be a little painful, and it can be a little bit more of an intense procedure than just inserting it. So it's best to start out small to see results, and then if you love those results, then you can work your way up to a better thread. PLLA is what I tend to use the most of, because those can last anywhere from 8, 9 months up to 12 months within the skin, so those results are gonna last up to a year. I just love those results. You're gonna get more collagen building from the PLLA versus the PDO, so that's another reason why I like it. But PLLA, once inserted, it's gonna help you accumulate water to that area, and it's also gonna help build connective tissues. It's gonna help produce that collagen, and those are all good things that we want. Today I'm gonna show you how I'm gonna be laying my temporal region PLLA threads for hollowing temples. So again, it's always best to start low and slow, and then work your way up to desired results. So what I've already done, I've already gone and I've put a dot where my temporal artery is. Now, this is not a filler, so there's not gonna be a risk of a vascular occlusion. The reason why I have marked off my temporal artery is because it is a very large artery, and you could tend to, bruise easily and have a hematoma. So while that's not dangerous, it's a little unsightly, and I don't wear makeup, so there's no covering that up. And even if you were to wear makeup, it'd be a pretty nasty bruise, I would expect. So the temporal artery is a very easy artery to find. If you just lightly touch over your skin, you can feel that artery. So you just want to put a little dot there just so you know it's there. Again, if you just lightly rub your finger over, you can actually feel that artery. So I have a handy dandy surgical marker, and I'm just gonna mark where I'm gonna lay my threads. Now, you can already see the hollowness. I'm wide here, and then I tend to dip. So I tend to be wide here, and I tend to dip. So this is gonna be the treatment area. So I'm just gonna use my mirror, and I'm gonna go ahead and mark. This is only gonna be about 5 threads per area, so it's not that many, and it's very quick. So I'm just gonna mark up these areas, and we will get started. It's gonna be 5 threads on each side, so relatively fast, relatively easy. You can see where I'm flat and hollow here, flat and hollow here. So essentially what I'm gonna be doing is I'm just gonna be placing those threads this way, and then these other ones are gonna come through and support those threads that we had just laid down. Now I've already cleansed and disinfected my skin with 70% isopropyl alcohol. I will put some gloves on. Now the threads that I'm gonna be using today are a 30 gauge 25 millimeter. So they aren't super long, they don't have to be super long. Now I'm only using a shorter length because I don't feel I need a longer one. If you feel you need longer than a 25 millimeter, you could always use a 38 millimeter. But as I mentioned before, it's best to start low and slow and build up your comfortability with using threads. So we're just gonna start with the 25 millimeter, and if I feel like I need a longer one or a different one, then I can always add more later. Now, when you open your needle, you have a stopper on one end of the thread. So there's a flat part, and then there's an open part. And essentially, the flat part, you want to be flush against your skin, and the open part to be away from the skin. So you're not gonna wanna push this plunger back all the way, because if you push this little stopper back all the way to the very end, as you're trying to insert the thread, there's gonna be too much bunching. So you want this to stay at a nice midway point. You don't have to insert your entire needle to the very base. You just really need to focus on where that needle is going and where that stopper comes off, because where that stopper comes off, that thread is now released into the skin. All right, so we're gonna go ahead and get started. This is a very shallow, it's a very superficial type of insertion. You're not going too deep into the skin. Now essentially I'm just going to be crisscrossing these. And so there we go. So we have our 2 going this way, and then we have 3 going this way. So I'm just gonna let those sit there for a minute just to cause a little hemostasis. And that's just essentially clotting up the blood so that way I'm not bleeding all over the place. So since I inserted these first, I'm just gonna spin them around a little bit just to make sure that thread is off. I'm just gonna hold right up here, and I'm just gonna pull those out nice and slow. Twist, twist, twist. Hold there. So now I'm gonna get a little bit of collagen production. Now, since this is PLLA, I'm not gonna really see any immediate results. Any type of immediate result is just gonna be a little bit of swelling, which that will subside. But this is cumulative. So about every 2 months or so, I'm just gonna go back in. I'm gonna rethread those. And since I did the 25 millimeter this time, that's what I had on hand. I'm thinking maybe next time I might possibly use a 38 millimeter just to cover more surface area. I'll have some subtle results. I'll have more natural looking results probably in the next maybe about 4 to 6 weeks. That's gonna kind of be like the sweet spot when you start noticing that. Because that 4 to 6 weeks, you're gonna have a little bit of water accumulation, the connective tissue is gonna start to form around the thread. But that's essentially how you would place thread. You're just essentially placing a hashtag mark, or you're just creating that mesh foundation to give that overall support to the skin. That's my procedure. That is the PLLA threads in the temporal region, and that is how I do that. So if you like this video, go ahead and give it a thumbs up and like and subscribe. If you love to see more videos like this one, you can head on over to my channel at youtube.com/Christopher McGrady to see more new and exciting content. That's all I got for you guys today. So until next time, I have some other videos in the work, but until then, stay healthy, be well, bye.